Do you feel like your hip flexors are always tight? First of all, let's chat through what the hip flexor is, what it's not, and maybe why tension isn't the primary issue. Hi, I'm Dr. Zach Ratliff, sports chiropractor at TruMotion Therapy, where we specialize in the conservative management of musculoskeletal pain and injuries. So the hip flexors are actually a group of 3 different muscles, all with kind of different start and end points. So let's break that down. So the primary one that most people think of, the funny sounding one called the psoas, it actually starts right at the base of the rib cage or right underneath that diaphragm and goes all the way down to the groin. Now this is one of the bigger hip flexor muscles, and from this, if that muscle contracts, it's going to flex that hip. Now, one of the other muscles that contributes to hip flexion is going to be the iliacus. It goes from the inside of this hip crest and then goes to a similar spot on near the groin. The third one is actually one of our quad muscles that crosses both the knee joint, but also crosses that hip joint. And this is the rectus femoris, and it is the quad that goes straight down the center, and for a lot of us feels very tight. So that brings us back to kind of our initial thought of, is tension in my hip flexors the issue? And rather, I would challenge that oftentimes it is weakness in these muscles that causes them to be, quote, tight. So if a muscle doesn't feel like it can stabilize an area properly, what it will do in turn, or what the brain does to adapt, is it locks that muscle down, makes it tight and stiff. And so what that does is does create a form of stability, but that stiffness and tension comes at the expense of performance and mobility. So what I'd like to go through now is 3 of my favorite exercises to help strengthen these muscles, which in turn will make them feel more loose and a little bit more comfortable for a lot of people that are either sitting all day, where those hip flexors are kind of in a shortened contracted position, or if you're a runner, weightlifter, CrossFitter. All these exercises are going to be great for strengthening these muscles and boosting your performance. First exercise we're going to go through is called the psoas march. And what we're going to do, we're going to use one of these little continuous bands. It's going to be similar to a dead bug exercise. But with the band around the feet, we're going to get a little extra muscle activation around those hip flexors. So we're going to come up into that dead bug position. Low back is nice and flat on the ground. And then what we're going to do one at a time is we're going to extend one leg as the other stays right where it's at. And so as we switch, the leg that's extending is lengthening that hip flexor or psoas muscle. And then the one that is staying in place is putting a concentrated strength effort on that hip flexor. So simultaneously, we're working both hip flexors just through a different muscle contraction. So the foot extending is showing that muscle how to stabilize while in a lengthened state, while the knee staying up is getting a nice muscle contraction, flexing the hip. All right, the next exercise is going to help target those hip flexors is called an end range liftoff. So using a weight, it can be a weight, an object, really just something to get your foot over top of, just as a little bit for feedback. So what we're going to do, we're going to use our hands to really prop up, keep our core nice and stiff, keep our spine nice and tall. And then what we're going to do is you're going to squeeze your quad, and then you're going to lift your whole leg over top of that weight, and just nice, slow and controlled, keeping nice height above that object that you're working. And you're just going to keep going back and forth over top. Again, nice, slow and controlled. And that's going to help target the quad as well as some of those hip flexors a little bit closer to the hip. Sometimes this exercise can cause some muscle cramping because we are isolating that muscle. So be cautious of that, but that is okay. It's part of us strengthening those tissues, but muscle cramping might happen, totally fine. As it gets stronger, that should dissipate. All right, the third exercise we're gonna do is a adaptation of kind of a single leg balance, but we're gonna add a band to it. And so what we're gonna do, you're gonna throw one leg through that band, so that band can just hang out right on your ankle. We're gonna balance on the opposite foot, and we're gonna take a little step away so we already have some tension in that band. And then what you're gonna do is you're gonna bring that one knee up with the opposite arm, and then slowly let it come back down. So we're kind of mimicking a running position, but I'm getting that squeeze of that hip flexor, and then I'm controlling it as it lengthens behind me. So just nice and easy, working through there, feeling balanced and controlled the whole time.